Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about inflammatory bowel disease or IBD. There are two types of IBDs or inflammatory bowel disease, and let's look at them right now. So IBD typically involve the colon, but of course, one of the types of IBD involve the whole GIT. Now, the two types of IBDs are in ulcerative colitis and Crohn's disease. When we're talking about ulcerative colitis, it mainly presents with the inflammations of the rectal and the sigmoid colon. About 40 to 50% referred to as proctitis. Now comparing that to Crohn's disease, in Crohn's disease, the main area affected is the cecum or the ileum. The ileocecal area, or 40% of the Crohn's cases, involve the ileal and ileoclonic area. The second most common area affecting the Crohn's is the small intestine, about 30 to 40% of the cases. And in the small intestines, we have the inflammations in the segments. This term is the skip lesions. Some people who have a Crohn's can have skip lesions in the colons of the large intestine. 20% of Crohn's disease cases have these, and this is referred to as the Crohn's colitis. And finally, a small or majority cases of the perineal inflammations. So those were the four most common areas affected on the Crohn's disease. And as we've learned, a typical characteristics of Crohn's disease are skip lesions. Going back to ulcerative colitis, the main areas affected, as we talked about, is the rectal or the sigmoid area. And this term, proctitis. Well, a characteristic of all sorts of colitis is that the inflammations can spread, and it spreads approximately. So, from the rectal or the sigmoid area up to the descending colon. 30 to 40% of all sorts of colitis cases have these, and this termed as the left-sided colitis. In the inflammations spread far enough that it reaches the transverse colon. This is known as the extensive colitis. So, we just saw the common areas affected in the ulcerative colitis and Crohn's disease. And we saw that they had some differences in the ulcerative colitis. It spreads to the distal to proximal. And the Crohn's disease have skip lesions and mainly affects the ileocecal area. But there's a lot more differences which we will go over later on. But first, let us look at the signs and symptoms associated with the inflammatory bowel disease. So signs and symptoms of the inflammatory bowel disease can include, but not always, diarrhea, rectal bleeding, abdominal pain, tenesmus, fever, weight loss, vomiting, cramps, and muscle spasms. Let us look more at the differences now and similarities between the two types of the inflammatory bowel disease. So, we will look at the differences in gender, incidence, smoking, associations, onsets, locations, pathology, histological differences, as well as the complications. So, in all sorts of colitis, both genders are affected in the same ratio, whereas in Crohn's, there's an affected more in female than in male. Incidence of ulcerative colitis and Crohn's disease are similar, except there are more cases of the Crohn's disease diagnosed per year, 2.1 to 20 per 100,000. Smoking is very interesting for inflammatory bowel disease because for ulcerative colitis, smoking is actually a protective factor. Whereas if you smoke in Crohn's disease, this actually aggravates the condition. The onset of ulcerative colitis and the Crohn's are roughly the same. The locations which we have talked about earlier for both ulcerative colitis is mainly the distal colon, the rectum and the sigmoid area, and for Crohn's disease is the distal ileum and the cecum, but it can also affect the other areas along the GIT. Now, let's talk about the pathology and the differences. So, for all sorts of colitis, it is a continuous inflammatory lesions that basically progress is from the distal colon to the proximal colon. Now, where in Crohn's, it is typically discontinuous, patchy gut, inflammations with skip lesions. Histologically, ulcerative colitis is a superficial inflammation, whereas Crohn's disease is a transmural inflammation, which means that it actually goes through all the layers of the colon. Complications of ulcerative colitis include severe bleeding, toxic megacolon, rupture of the bowel, as well as the colon cancer. For Crohn's disease, complications is more severe because histologically it affects all the layers of the GT transmural inflammations. So therefore, complications include stenosis, abscess formations, fistula, colon cancer, as well as the perforations. Okay, now let's put all these into diagrams. Let us first zoom into the ulcerative colitis affected the colon here. So here is the inflammations of the large intestines. The superficial inflammations. Remember also we have the colitis. It changes as in the relapsing and remitting. When the disease is active, it causes ulcerations and inflammations. When inactive, the cells are basically dying. You get atrophy of the cells following the inflammatory reactions. In ulcerative colitis, you can get complications such as severe bleeding, toxic megacolon, rupture of the bowel, and colon cancer. Now, if we were taken to sections of the large intestines, we have the histological layers of the core. Remember also we have the colitis. It changes as in the relapsing and remitting. When the disease is active, it causes ulcerations and inflammations. When inactive, the cells are basically dying. You get atrophy of the cells following the inflammatory reactions, and that it can lead to perforation fistula.